Different types of bone fracture. This is, you will not be tested on there, so we won't go through it. Effects of bones, nutrient and exercise, vitamins, minerals, all these affects bones. Influence osteoblasts and osteoclasts, retard bone development, necessary for collagen. Vitamin C is necessary for collagen, result in fragile bone if you do not have enough vitamin C. Okay, it's called osteogenesis imperfecta. Vitamin D is good for absorption of calcium, and without it, you have rickets, osteomalacia. Vitamin K support minerals, may assist with vitamin D. Minerals, calcium, obviously, okay, it's for bone development. Magnesium is most is found in bones. It also helps the structure. Fluoride stabilize and strengthen the bone. Also increase density. Exercise, again, also bone growth due to muscle use. More exercise, stronger bone. Tissue adapts to the need. Now there are some hormones that is going to be affecting bone growth. Where it comes from the pituitary gland, thyroid gland, parathyroid, ovaries, and testes. Growth hormones, obviously the name tells you. You start growing, becoming a teenager. Exercise help release more growth hormones. Trigger chondrocyte proliferation in the plate. Stimulate osteoblasts and calcium retention. Some of the problem is dwarfism, giantism, or acromegaly, okay, where there's a problem with the growth hormones. Thyroxine comes from the thyroid. Promote osteoblastic activity, okay, also affects growth hormone. Parathyroid is next to your thyroid. Stimulate osteoclast activity. Reabsorption of calcium in the kidney and absorption in the small intestines. Calcitonin inhibits osteoclast. So if you have too much osteoclast, the body says, hey, that's enough. And then calcitonin will be released. Okay. Stimulate calcium uptake by the bone. So now, instead of breaking it down, it will absorb it. Okay. Sex hormones promote osteoblastic and bone formation, stimulate ossification and epiphyseal plate. Okay, just remember. I mean, it's kind of just gotta remember it and kind of put it all together. Okay. So here is a kind of a homeostasis kind of chart. Okay. So if we see here's homeostasis. Okay. Normal calcium level is 10 milligram per deciliter. Okay. This is a normal calcium level. Now, if calcium level increases, thyroid gland will then release calcitonin. You remember what calcitonin does? Calcitonin will inhibit the osteoclast activity, stimulate calcium uptake. So now here's the normal calcium. When there's calcium is too much, well, it's getting higher and higher, then the body tells osteoclastic activity to stop, absorb more calcium into the bone. Okay. So now the calcium level in the blood goes back to normal. Now, if there's a sudden decrease of calcium level, so calcium is very important for muscle contraction, especially your heart. You know, heart is a muscle, so it needs to beat. So that level needs to be maintained very accurately. So your body is constantly, you know, remodeling and maintaining homeostasis. So here we have a decrease of calcium level. Parathyroid gland releases parathyroid hormone. Osteoclast will release calcium from the bone because now the osteoclast needs some extra calcium. It goes to the bones to get more calcium. Calcium is also then reabsorbed by the kidney, so it doesn't pee out. Calcium reabsorbed in the small intestines via vitamin D synthesis. Now there's calcium. Calcium will start increasing in your blood. It's going to go up and back to normal. Okay, now again, if the body accidentally did too much, they start going on this process. Okay? So here's a summary of everything, if you want to read through it. Bone function. Bone also helps with blood formation. Okay, that's why the red blood cells is for blood formation. Hematopoiesis, that's the term. Hemato means blood. Okay, poiesis is forming. So formation of blood cells. Okay, in adult, the red bone marrow, spongy bone, and the skull, ribs, sternum, clavicle, it all have bone marrow, red bone marrows. Marrow, the medullary cavity. Remember where the medullary cavity is? Is in the diaphysis, in the long bone, in the middle. That's the medullary cavity. In the long bone, in the space of the spongy bone, appear as red, as on top, and the yellow part is the in the middle. Okay, that's the fat storage. Okay, that's the part 1 of the chapter 6. Now we're gonna have learn a lot about some of these bones, the name of them. Okay, we'll learn about the appendicular skeleton, just most of the bones. Okay, not all of it. Okay, covers the pectorals and the limbs, pelvic and the lower limbs. So first thing we'll learn is the scapula. Okay, we're gonna learn in the lab when we touch the actual scapula. You need to know where the front and the back is, or anterior or posterior. Okay, where's the medial part? Where is the lateral part? Okay, but just looking at this, okay, if you look at the back of the person, okay, so we'll look at it in the lab. That'll make it more easier for you to see. Okay, but let's learn some landmarks. Okay, the scapula again is a flat triangular bone with 3 fossa in it. 3 fossa. What's fossa? If you remember, fossa are holes, okay, where things are attached to it. Okay. Glenoid cavity. So if you look at this hole, that's where the arm goes, the humerus, right there. This hole is called a glenoid cavity or glenoid fossa. Okay. Here, right here. So actually, this one you're looking at the back of the person. If you put their hand on their scapula, okay, this part right here is the spine of the scapula. So this is the back, and this is the front. This is the front that's touching the ribs. Okay, so if you look at the back, there's a spine. Okay, just remember our back has a spine, and the scapula, the back of the scapula has a spine. Okay. And this one right here is the acromion process. Okay. And this one is a coracoid process. Coracoid process. Okay. So again, here's the superior border. Here's the anterior view. This is the medial side, because this is where the arm goes. So the arm goes to the lateral side. This is the glenoid cavity or glenoid fossa. So again, here's the front view now. See, there's no spine. Here are the ribs. That's the arm. The clavicle articulates with the scapula at the AC joint. They call it the AC joint because A is the acromion and C is for clavicle. So this is the AC joint. So the clavicle will articulate with the acromion. And here's the coracoid process. Sticks out on its own. It's not articulating with anything but for a muscle attachment. Okay, we're going to look at the scapula, and you find out, you can see that this one is the sternal end. It articulates with the sternum. Here is the upper limb. This is the humerus. We have to, in the lab, we'll see it better. Some of the students always get confused with the humerus and the femur. Okay, humerus and femur. They look very much alike, but they're, again, very, very different once you get to know it. Okay. Okay, so the humerus. Okay, there's the head of the humerus. Okay, here is the greater tubercle, lesser tubercle. Okay, the greater and lesser tubercle. Tuberosity, right here. Here is the epicondyle, the medial epicondyle and the lateral epicondyles. Epicondyle is where the your elbow joint is. Okay, so medial obviously is the inside part, and the lateral is on the outside part. Now remember the anatomical